What is your back pain like? Is it localized to just your low back? Does it shoot down to one side or both sides? Do you get numbness or tingling down to your calf or your foot? Or maybe it gets worse when you walk for a long time or stand for a long time. Does it get better when you lean forward or sit down? Welcome back to Premier Care. There's a couple different reasons and conditions why we get low back pain, and we'll be talking about one of them today, and that's lumbar stenosis. When talking about lumbar stenosis, it actually sounds a lot more intimidating than it really is. We can break it down into lumbar meaning low back and stenosis meaning narrowing. Lumbar stenosis is usually in regard to the spinal canal, which houses the spinal cord along with the exiting spinal nerves. When lumbar stenosis occurs, it compresses the spinal cord or the spinal nerves, which in turn causes symptoms. Some symptoms you may expect include low back pain, pain shooting down the back of the leg, into the calf, or into the foot, and this can appear as either numbness or tingling, or weakness or heaviness as well. The reason behind this is because signals of motor control and sensation travels up and down from the brain and to those supplied areas via these nerves, and when these nerves are compressed, you'll find these symptoms. So now you're probably wondering what causes lumbar stenosis or stenosis in general. Some common causes are disc bulging and ligament thickening, which is a common cause or process of aging. Another is disc herniations. As a review, the discs are located on the anterior front side of the spine, which are sandwiched between the vertebral bodies that are stacked on top of each other. Each disc is comprised of a thick, tough annulus fibrosus and a jelly-like center called the nucleus propulsus. If you can imagine it, the disc is like a jelly donut, the outside being the dough and the inside being the jelly. The disc itself has the role of shock absorption, but just like shock absorbers in your car, they wear out over time, and it's important that you take care of them. This bulging occurs when the fibers of the annulus fibrosus starts to weaken and it starts to bulge out. The bulging out is the nucleus propulsus starting to push out. This appears like a deflated tire. A disc herniation, on the other hand, is when the annulus fibrosus fully tears and the nucleus propulsus, the gel-like substance, starts to leak out into the spinal canal. So the bulging of the disc, or the protrusion of the nucleus propulsus, ends up pushing onto the spinal cord or the spinal nerve, which causes the symptoms. The other common cause is facet hypertrophy, which is the enlargement or degeneration of the facet joints. As a review, the facet joints are the joints of the spine located posteriorly or in the back. They are at each level of the vertebrae, and they're located bilaterally, meaning both sides. Hypertrophy means enlargement of tissue or cells. You may have heard of hypertrophy when it comes to muscle hypertrophy when strength training, which means muscle growth. In this case, facet hypertrophy means growth of bones or bone spurs on top of those joints. Bony hypertrophy is a response to increased stresses and loads onto the joint, which leads to increased density and size. Through this mechanism, the bony overgrowth can protrude anteriorly and start compressing the spinal cord or the exiting spinal nerves, which causes symptoms. Symptoms usually occur as back pain, buttock pain, leg pain, calf pain, foot pain. The back pain usually appears in a pattern of getting worse when standing or walking for prolonged periods of times. Patients will also find relief when they sit down or lean forward. Pain or discomfort improves with leaning forward or sitting down because it actually opens up the spinal canal a bit, relieving pressure off the spinal cord as well as the spinal nerves. A common similarity among patients with lumbar stenosis is that when they're out shopping for groceries, they find relief when leaning forward on a shopping cart. Lumbar stenosis can occur in a few various types, one being congenital lumbar stenosis, meaning that you are born with it. You're born with a naturally narrow spinal canal. The others are multi-level and single-level spinal stenosis. It's multi-level meaning that it occurs at various spinal levels, and single-level meaning that it occurs at one level. Additionally, single-level spinal stenosis can be differentiated into unilateral and bilateral, meaning the stenosis occurs at one side versus both sides. And you'll see that symptoms will travel either on one side or both sides. With a detailed examination and history report, we are able to figure out what nerve distribution is being affected and then locate specifically where that spinal stenosis is occurring. Symptoms of pain or discomfort occur mainly for two reasons. One being the physical compression of the nerve itself, or the reaction of the physical compression of the nerve, which is inflammation. So the goals for non-surgical treatment is alleviating that inflammation. This can be either through a course of anti-inflammatory medication prescribed by your physician or through physical therapy. If the preceding treatments do not improve your pain, your physician may recommend epidural steroidal injections, which is a local anesthetic and steroid that is injected into the epidural space, which surrounds your spinal cord and spinal nerves. By doing so, we can decrease the pain and inflammation there that is causing your low back pain. If severe enough, your physician may recommend a surgical procedure to decompress your nerve or free up the nerve. Another procedure involves fusing two or more vertebrae together to limit movement and decrease further degeneration of that spine. To find the treatment that suits you best, contact your physician or physical therapist first. So I hope you liked today's video, and I hope you learned a little bit of something. If you enjoyed it, make sure you hit the thumbs up button. If you have any comments or feedback, make sure you include it in the box below. And make sure you don't miss out on any future videos by hitting the subscribe button. Thanks for watching.